Is knee pain keeping you from doing what you love? Stay tuned and watch this video. Like many of you watching this, I've also experienced knee pain at various points of my life. Most recently, I've experienced knee pain after playing intramural soccer, which I didn't think would happen. I've never had knee pain before in my life, and I've been a runner since I was 14 years old. I'm now 27 and counting, and I still don't really experience knee pain unless I'm playing soccer. So what gives? What's going on? I did a deep dive so you don't have to. So you're here to talk about knee pain, aka runner's knee, or aka chondromalacia patellae. But what is it and what causes it? That annoying pain you feel right here is simply a muscle imbalance, for the most part. Really, it's those muscles not being able to guide your patella over the groove that it's supposed to slide over. And that can cause irritation and inflammation and pain in that area. But don't worry, we're going to get to the bottom of it. What people often forget is that with sports like running, it's really a one-legged sport. For a split second, your entire load is on one leg. And if your glutes or your core or the muscles that are supposed to lift your legs and take that load aren't prepared for it, that can cause knee pain, ankle pain, hip pain, back pain, and all sorts of problems. But let's get back to what you're here for, runner's knee. How do we fix it in-house? If you can't fix it in-house with these exercises, you should consider seeing a provider. So what is the first phase of treatment? Well, you probably have really tight quads and hamstrings and hip flexors and tight glutes because everyone's trying to overwork, compensate, and hold everything together. So the first phase is going to be stretching out those groups. So those groups, what they do, hamstring and glutes are going to pull that hip back, and the quad and the hip flexors like the psoas are going to pull that hip up. So I'm going to show you some really quick stretches that you can do anywhere in your house, in your bedroom, in the office. There's really no excuse, so you have to do them. The first one I'm going to show you is for your hamstring. So ideally you'd want to use a doorway so you don't end up looking like I do. But it's super easy. All you want to do is put your leg up and stretch your hamstring. Just hold it for like 30 seconds. And then switch. If you have a doorway, your other leg won't look like mine. Just make sure that whoever's wall it is okay with you putting your feet up there. The second one is going to be a stretch for that IT band, this whole area, glute med. So what you're going to do is you're going to put your legs, let me do this. You're going to put your hands on the wall, and then you're going to cross over, and you're just going to dip in to that side and then hold. The last thing you're gonna do is you want to stretch out those quads. So what you want to do is you want to just hold here and stretch. If you need something a little more advanced, you can get on the ground and do this. That's it. Let's move on to the next phase. The first exercise that we're going to do is a stiff leg deadlift. Why are we doing this? Remember we talked about how the quads, the hamstrings, the glutes, they all have to work together in order to bring that leg up, back, when you're walking, through the swing phase, when you're running. All those things need to happen at the hip level. So what are we going to do? We're going to strengthen those hips. How are we going to do them? First one, deadlift. Since we talked about how walking and running is a single leg sport, we're going to do them single-legged. So what I'm going to do is I'm going to place my hand, we'll start on this side actually, we're going to place my hand on my hip, make sure I'm touching my rib cage, and what I'm going to do is I'm going to place my other foot right behind right here, and I'm going to make sure that there's a slight bend in this knee, and I'm going to hinge from my hip. I'm not going to hinge up here, hinge from here. So it's going to look like this. And I should feel that in my glute and in my hamstring. Mine might not look perfect, yours might not look perfect, but we're trying. We want to continue to strengthen our glutes and our hips. So this one is, again, a no excuse exercise. What you're going to do is you're going to grab a chair. It doesn't matter where you are. You can do this anywhere. Make sure your feet are firmly planted on the ground, and you're going to slide to the edge of your seat, and you're just going to get up And then you're going to sit back down. It helps me if I put my arms out here so I feel a little more balanced. You can try it too. I'm just going to get up and sit back down. I do feel this already, so I guarantee you will too. And the goal eventually is to do it single-legged. This last one is called a short arc extension, and all you need is a pillow. I stole this one from the office. What you're going to do is you're going to place your leg over it. Make sure your knee is in line with that pillow. Should look something like this. And what you're going to want to do is you're going to want to extend that quad in order to really activate that muscle group and then relax it down. And then you're just going to repeat this about 10 times, and you're going to do it bilaterally. So now that we've explained what runner's knee and chondromalacia patella is, you should be all fixed, right? No, just kidding. Make sure you try out the stretches with the exercises because both together are going to work best for you. If in fact you try these and nothing has changed, please go see somebody so you can get some professional help with your issues so you can get back to work and back to play and doing the things that you love. Thanks so much for watching.